All right, welcome back. We're taking your questions about the COVID-19 vaccine, and you can, again, text us those questions. We have Cone Health Chief Pharmacy Officer Dr. Deanne Brooks with us to help answer your questions. All right, so the first question that we have in the queue is, if you took the J&J vaccine and you need a booster, can you take another vaccine brand?
And so that's an interesting question. Right now, for our COVID-19 vaccines, we don't know for sure that we're going to need a booster. I know that there has been an announcement from Pfizer that they'll be ready for a booster, but we don't really have the data yet that says that we will absolutely have to have a booster. And what will occur is what occurs with the flu vaccine as well. If it's possible that it's needed for different variants, then that may occur, but we'll just have to wait until the data shows us exactly what we need.
This person is asking, are people under the age of 40 seeing harsher side effects after getting a vaccine compared to the people who are over the age of 40?
You know, it's really interesting, the side effects that we get from vaccine, because you can have even people in the same family, cousins that are the same age, that one will develop a symptom and the other will not. Early on, I did hear anecdotally that younger folks tended to have more side effects, but I don't think it's really borne out for sure.
This person is asking, does it cost money now to get a COVID test done if you need one?
No, it should not at any of our testing sites, and you also should not pay for the COVID vaccine as well.
This person is asking, should parents be worried now that more kids are going back to school full time?
You know, I think that we're using data to drive our decisions, and so I don't think I would be worried about my kids going back to school right now. From what we have in our community, I think that we're making the right decisions.
So this person is asking, can you still have side effects from the vaccine after your 2 weeks are up after the second shot?
I can't say that it's absolutely not possible. It would be very rare to still have any side effects. Even a sore arm typically is going to be gone within 2 weeks. So I would say whatever symptoms you're having, I would check it out with your healthcare professional.
So this is something, especially from the headlines that we've seen over the last couple of days, about possibly a booster shot, coming down the pike in 6 months or so. The person is asking, do doctors think vaccines will last for at least a year or not?
Yeah, we just don't have the information yet to know for sure. And as soon as we have that information, then we'll be able to give more direction on exactly what the recommendations will be.
And then this question is, what is the best vaccine to get if I've already had COVID?
Yeah, so any of the vaccines, of course, not Johnson & Johnson right now, but there's not one that's better than another, but it is important to go ahead and be vaccinated even though you have had COVID-19, and there is data to support that as well.
And should you wait? Let's just do that follow-up question. How long should you wait after you've had COVID to get your vaccine?
Yeah, so at one time we were really recommending to wait up to about 90 days afterwards because we have some natural immunity, and that was more when we had less of a supply of the vaccine. Right now, it's safe to get it at any time. You just want to make sure that you're out of quarantine and that you're not coming to get the vaccine when you're in your quarantine period.
This person is asking, is there any sign that the COVID vaccine can lead to infertility or miscarriages?
Okay, great question. And before I answer that, Tanya, I want to go back to that other question and share that if you had COVID-19 and you received one of the monoclonal antibodies, you would want to wait 90 days until you get your vaccine then. And then back to the fertility question, that is a question that a lot of folks are asking, particularly our age-bearing population. And there has been no data to show that it affects fertility. It's also safe in breastfeeding as well. And Dr. Carolyn Haraway-Smith, our medical director of obstetrics and gynecology, she actually has a very nice piece that was done and is on our website, conehealth.com/vaccine, that you can listen to her speak about that.
All right, and this person is asking, if I'm fully vaccinated, why do I have to continue to wear a mask?
Yeah, you still have to wear a mask because it's possible that you could have the virus and not know it because you are protected, and you could potentially spread the vaccine to someone else. Now, if you are in the company of family or friends and everyone is fully vaccinated up to 2 weeks after their second vaccine or their first vaccine with Johnson & Johnson, you would be at very low risk, and you could potentially be with them without a mask.
But right now, we don't know, even if you have the vaccine, if you might be able to carry COVID and give it to somebody else. Okay,
yes,
we don't know that as of yet.
To still carry it and to give it to someone.
We're learning as we go, as we have since the start of this whole thing last March. All right, we're going to continue to answer your questions in our final segment. It's going to be after the break. Don't forget that you can text us your questions.